Welcome. I'm Ross Caputo, CEO of Analytical, and David Hussong and I are back to discuss with you some questions in and around COVID, where we are today, the issue of vaccines and vaccinations, issues of boosters, issues of perhaps some misconceptions of what happens or doesn't happen when you get the vaccine. So with that, I want you to do me a favor, do the audience a favor. Could you just give me what you consider the current state of the COVID-19 vaccines today?
Well, the state of the vaccines are the knowledge is being developed constantly. However, we now have one vaccine that has had enough data analyzed that the Food and Drug Administration has licensed that vaccine for use in people 16 and older. Now, that's a big plus because we're getting the more vulnerable population, the older people. They're going to have the vaccine available. Once they've had the vaccine in a few weeks, they will have developed tremendous advantage in immune response. Those people will, if exposed, get either a very mild infection or not even notice that they're infected. So that's a really big step forward. Eventually, we will have data showing the effect for children, the proper doses, and how long that immunity lasts. So the information is evolving. We've got one of the big three vaccines licensed. We'll have the other two with enough information to make a decision soon.
David, you said one of the big three, and we know that there's always been a question that both Pfizer and Moderna are these new synthetic mRNA type vaccines compared to the J&J, which is more routine, we should say. And yet, just this past weekend, Dr. Fauci was talking about on CNN that, well, the J&J vaccine, one shot, one dose, but only 66% effective compared to the other two being 96% effective. Effective against what? And is that 30% important? And what about this Delta variant? There's so many of these questions. What is someone supposed to do? I got approval for 16 and over. What good is it?
Well, if we look at the number of people who can spread a virus, we have to get that number down so that the infectivity is reduced and people are not getting this virus throughout the community. Just by having people immunized, even at a 60-some% effectiveness, that means we're going to have fewer people out there spreading the virus. Now, the 60% number, I think, refers to cases requiring hospitalization. Those are severe clinical cases.
Okay, good.
If you have less effectiveness, that does not mean that you're going to get a very bad case. And even if you are dealing with a 95% effectiveness, you still can get infected just because you're near somebody, but you might not even notice it, or you might have a slight cough. It's much like the flu. When you have the flu vaccine, your flu shot each year, your chance of getting seriously ill is greatly reduced. You can still get the flu. And there are many different strains of flu circulating at any time. Generally, CDC and FDA try to guess which flu is coming. They do that with epidemiologic data, and they make a prediction. So the weather forecaster might say a storm is coming, and CDC might say influenza A is coming. For influenza A, you can prepare vaccines. Last year, I got a quadrivalent flu shot that meant covering 4 different strains. I still got the flu, but it was not as bad as it could have been. In my age group, you can get seriously ill with flu. And the same can apply to COVID.
All right, David, you gave me so many more questions just from giving me those facts and the truth. I know today that there have been over 200 million cases of COVID in the globe, and 4.5 million people have died in the world. There have been 5 billion doses of vaccines given in the world today. Yet I know that where the numbers went down for a period of time, right now we have such an increase in not only infectivity, but kids getting sick, kids going into the hospital, kids being on ventilators. When I say kids, I mean 6 years old, 9 years old. So this vaccine so far, and we're going to ask some specific questions later, but just for background, so that now I have a vaccine for 16. What about my 10-year-old? What about my 11-year-old? When is that help for parents' hearts and minds going to come?
Well, that's a really tough one because of the emotional factors involved. Originally, the COVID infections were not affecting children very badly. By that, I mean in great numbers. We were seeing that children were able to fight it off. There were exceptional cases where children got very ill, particularly with cardiac issues. There were permanent pulmonary damage issues and some neurologic effects from the infections. And while those were not as common as they would be in an adult, we had a serious problem with those children who did get sick. And a lot of young people, there was a case that was very well published early on about a college basketball player. He got the infection. He came out of it apparently quite well, but then he collapsed from cardiac issues when he returned to play. This inflammation of the heart is a very, very serious side effect of this infection. And I've even had an acquaintance have to get open heart surgery to repair the damage. So the infection can be very, very serious. And unsurprisingly, there are much less frequent, but there are some side effects to the vaccine. The same immune responses that cause some of these problems can happen with the vaccine. Not as frequently because we can control the dosage of the vaccine. When the virus hits, you have no control over the damage.
David, I have a question that I've been asked, and I'm not quite sure how to answer it because I think I know the answer. But I've got a 6'5", 300-pound guy who gets the same dose as my 16-year-old who right now weighs 110 pounds. Does that make sense to you?
In some senses, it may not, just from the idea of what's the exposure. But this is an immune response. And it carries through the same physiology as an allergic response, because very much it's the same thing. Your system reacts to an exposure. If you're exposed to a little pollen, you still sneeze very much. And yes, you can get a stronger response from a lot of pollen, but you're going to have your immune system primed with a dose of the antigen. And the antigen is what we're preparing in vaccines. In the mRNA, it has your body make the antigen. With the other doses, like the Janssen, the J&J product, you get the virus, and the virus is a platform to deliver the antigen. So either way, your body will react. And that reaction, it might be stronger with a bigger dose, So yeah, maybe he should, at 300 pounds, get a greater dose. He can certainly withstand that insult of protein.
So as we see these doses and things, we talk about it, and I want to focus just for a little bit. I always assumed, and I think this is what you said, that the way we protect the younger folks, the folks that can't get the vaccines, the folks that it's not approved for yet, is the more we limit the exposure by having more people protected, there's less virus they're going to come in contact with. That's how you protect your kids, by you yourself being vaccinated and you don't bring the disease to them. School is starting. There is a lot of issues going on with, are they now going to start being exposed more? To which, frankly, the answer is yes. If you're at home with your door shut, you don't get exposed. You go out with 100 kids bumping into each other, knocking on their lockers, etc., you're going to get exposed. But that's a fact of life. You get exposed, as you said, David, to the flu, to everything. That happens. The question that comes down to is that as they go back and do that, should not the parents be more vigilant, more aware of what their kids feel and look like when they come home? Am I extra tired? Do I have a headache? Normally, I used to say I had a headache so I didn't have to go to school the next day. Didn't work, but that's what happened. So I think in this real world that parents, as well as teachers, as well as all adults, need to be more aware of their environment. We have to get vaccinated. We have to get vaccinated to help those who can't. Is that pretty much one of the messages?
That is exactly the message. We have to be aware. And when my children were school age, I just remember they were always coming home with a runny nose, and we would consider the school the communicable disease center, because the viruses would just go rampant in there, and now it's more serious. We we had this problem years ago, children getting in close contact. We had diseases like polio. Many things were being spread, and over time, we were able to control them. Polio is a classic because we had a vaccine that evolved. It got better over time. We don't hear of polio that often anymore. That's a rare occurrence, where it used to be very common.
David, I want to ask this question here. Is it, before I forget it, I don't want to forget about it. So if I got the Moderna and now booster shot is approved officially with Pfizer, I think it's still approved under emergency use for Moderna, but I don't know that. Can I mix and match vaccines and boosters and that activity? Can I do that? There's clearly no approval for it, I think, right? I don't believe there's any approval for it.
I don't think the vaccines boosters are yet part of the approved labeling. I believe that's emergency use, and CDC has recommended that. So we're walking a fine line in terms of how much information we have and where the analysis of that is. So the information that is available has said that Pfizer is safe, it's reasonably effective. Safe is, of course, a relative term. There's always a risk with any drug, whether it's an aspirin or more complicated. But we understand the risks and know that the risks are much less with the vaccine than allowing people to go out and spread the virus. Some people will be killed by that virus. So where are we in the booster realm? We have information for Pfizer. It's effective for 6 to 8 months, and then you need a booster. And I believe it's a good idea to get it, any of the shots first. But CDC and FDA are recommending at this point that you use the same vaccine that you got before, assuming you didn't get a bad reaction the first time. So they're looking at it largely from a safety standpoint. You were okay the first time. You may not be with another vaccine next time around. So we understand the safety profile, and we're going to keep it safe as best we can.
I think that's great. What I mean by great, I think it's something that people can put their hands on. I took it the last time. I did fine. I'm comfortable taking it again. We had a question of concern that said, hey, I got it before, but I know some people got really sick. I don't want to go take Pfizer's or Moderna's if I did, or J&J's if I didn't take it before, just because it's available. The availability has certainly gotten it's much more prevalent, to be sure. I think that there's so much emotion and fear that I keep getting asked the question, I'm sure you do too, well, how many of the others have to get vaccinated so I don't have to bother? I think there's been a misconception, excuse me, based upon what we heard before about herd immunity. Herd immunity is, yes, it's great. I love it. It is no substitute for vaccinations. It is no substitute for therapies and treatment. Once we get it, it'll be great. But I mean, we've had 38, I'll give you more numbers, 38, almost 39 million cases, confirmed cases of COVID in the US. Out of that stuff, there were 637,000 deaths. And we have given doses, you ready for this? We have given vaccine doses in the US of 367 million. And my math could be off, but I don't think there's that many people in the country. So, but cut them in half, but 367 million doses in the US. What is this? Is herd immunity a substitute for vaccination?
Herd immunity will occur when you have people vaccinated. You'll have immune people in a large enough portion that the spreading is drastically reduced. If you have herd immunity, people will still get the infection.
Could you, David, please repeat that? I think people get confused that I'm vaccinated, I can't get the disease ever again, I can't spread it to anybody, so I'm safe forever? Now, the answer is no. Please repeat what you just said.
Yeah, well, if you have immunity, you may still get the infection, not as badly. Herd immunity means less people will be spreading the virus. Doesn't mean no people will be spreading the virus. There still will be people who are susceptible. They will get the virus. 6 months after the immunization, what we're seeing is people are getting reinfected. That's just the immunity has gone down. 6 months later, they may not be hospitalized if they're infected because the immune system has been primed already. You still have a memory response. You just don't have that primary barrier of antibodies flowing around. And in some situations, rabies virus, for example, there's a race that goes on from exposure to when the point is where you have produced antibodies. And some people get paralyzed and killed. Others just get a minor infection. The key thing here is to have some exposure, and the vaccine gives you that initial exposure that allows you to fend off the virus.
So, David, I really have to ask you this question, and I'm concerned about so much, I'm going to say misinformation, but maybe it's incomplete information. There was a pediatrician who indicated to a mother whose child now had COVID, and she was all concerned because she had had COVID several months ago. He told her that once you get COVID, you can never get COVID again. Is that true, David?
Well, it reminds me of a James Bond movie, Never Say Never. we have to keep in mind that your immunity will diminish over time. So it makes no sense to say you will never get it again. In the short term, you may not get it. In the long term, if that is out there, you will get it eventually.
I think I think the public health system is stressed. I think all the doctors, nurses, everyone is having just a very difficult time in trying to help people cope emotionally as well as physically. I am real sure that the emotional trauma will last years on what we've gone through here globally, not just this country, not just this neighborhood, but globally. But what happens is it hits us because it is local. It is us. It is our friends, our family. What do you tell the mother who's pregnant? Does she get vaccinated?
Well, ultimately, that's between her and her doctor. CDC has said the vaccine is effective and safe for pregnant women. Now, every person is an individual and immunologically different. So the pregnant mother-to-be should speak with a doctor and definitely should consider the vaccine, not only for her protection, but for the child's. Uh, Again, the virus has some very serious long-term health effects, and those will affect an unborn child. So it's very important to consider the balance here. And if it were my child, um, I know I told my daughter just the other day, she has to get that vaccine. She lives out in the very rural areas and thinks she's not exposed. And I'm telling her, get the vaccine.
I think there's fear, and I think sometimes the facts get lost. I mean, a year ago, you and I talked about that clearly this virus was airborne. And now everybody believes it was airborne. Anyone who has had any scientific training, high school level, frankly, understand that sneezes are bad and sneezes carry particles and particles carry organisms. You may not get down to the fact that self-respecting viruses don't fly, that they have to carry on something, therefore you have to have particles. But at the end of the day, sick people, you never want them coughing on you. You know that. It took us a year, and there are still people asking the question, should I wear a mask in a group? Now, if we were all vaccinated, I don't know. But I got to tell you, one of my fears going forward, probably for the rest, short period of time, 5 to 10 years, in a group, I'm wearing a mask, period. Because I believe, and this is where I want to go with this question, do you think there's a limit to the number of mutations that this coronavirus can go through?
There is a limit, but it's going to be beyond my comprehension. The coronavirus in general has been around over 50 years.
Right.
And it used to be that the strains that were out in public caused only a mild bronchitis. Again, as in chicken coronavirus, it's spread by mucosal secretions and droplets from a cough or a sneeze, or even just talking. As I talk, the energy in my vocal cords is vibrating up enough microparticles that they can carry virus. The purpose of, for example, a mask is to stop droplets. They're not tight enough to stop a virus, but then again, the virus doesn't travel without a droplet. So wear a mask, especially around people. And if other people are talking, they're generating droplets. If they're infected, those droplets will carry a virus. We if we get a good vaccination rate, we will suppress this virus transmission. It'll take months. Dr. Fauci was saying that if everybody were to go and get a vaccination, everybody who can tolerate one, if they all got vaccinated, we'd be out of this in about 8 months. If his numbers are correct, and I have no reason to doubt him other than nature is always confounding what we think is going to happen. If we could get out of this in 8 months, it would be a tremendous relief for us emotionally, economically, and on just about every other level. We would benefit. So be less concerned about the fears you hear on the internet. Talk to your doctor. And if you can tolerate it, get a vaccine.
Yeah, as I remember reading the piece on Pfizer, it had been tested for pregnant, it had been tested for those with diabetes, they'd been pregnant for they had done a reasonably good, as given the time span of testing certain people, certain classes. That information doesn't seem to be as public as some of the other mass media pieces. The last mass media piece I read that this wave of infections is the pandemic of the unvaccinated, okay? And it might be to some extent fueled by that, but I think if you believe that statement as an absolute, I'm afraid that they're going to miss your number one thing, which says, even if I'm vaccinated, I can get it. Even if I'm vaccinated, I can spread it. Even if I'm vaccinated, I can have an impact. I think that I don't want to say it's the pandemic of the unvaccinated, though certainly the majority, what is it, 95, 98% of all those getting really sick and going to the hospital are unvaccinated. I get it. But I don't want that vaccinated person to think that I don't have to have any precautions, that I don't have to be careful, that I don't have to be something. I just want people to use common sense. The numbers probably are the unvaccinated, right? I think you and I have seen the same numbers, high 90s, deaths clearly 99% or 98% are from the unvaccinated. That means 1% die that are vaccinated, just so we don't lose track of it. It may not be an epidemic or a pandemic, but certainly what it is something to be cautious about. The highest COVID numbers that we see are clearly in unvaccinated people. But if I heard you correctly, 6 months from now, for most people to be a year since they got their vaccinations, they may go into the not unvaccinated, but no longer immune category, which I'm not quite sure there's a big difference. And if the virus keeps being this infective, won't this or could this not be another wave, David? Could this not be another thing that we have to worry about our children, that we have to worry about our grandparents, that we have to worry about ourselves, our loved ones? This is a big emotional deal. What do you think?
Well, I see so many parallels with flu season. Every year we start off with a flu season that requires us to get a shot beforehand. We still may get it. And we have to be smart. We still wash our hands, try to keep our hands away from our eyes and other mucosal membranes so that we don't transmit the virus that way. This is the same mode of transmission as the flu. And the darn organism is capable of getting there, sometimes from a long distance. It's all probabilities, though. If you play it safe, you're going to be safer. You may not get as big a dose if you are exposed, and a lesser dose means a lesser infection. So the people who are not vaccinated are most susceptible. If a new strain comes out, then you will still have partial infection or partial protection, but not the full protection. So a 90% vaccine effectiveness against, let's say, the gamma strain, it might offer only 50% effectiveness against the delta strain. So what we have is get as protected as you can, make any infection as minimal as possible. Don't spread the virus. You can do that by getting vaccinated and keeping your vaccines updated. Every 10 years, I get a tetanus shot.
Yeah.
It's just, we have to do it. We're playing smart in our health. Um,
So David, I have to ask this question that we were asked, we continue to get asked and get questioned about convalescent antibody treatment, where they're getting antibodies from, well, explain convalescent antibody treatment. Treatment that they're now giving to children who are
yes.
in the pediatric ward. What is it? Is it approved? Does it make sense? Where does it come from? Can I get sick from it? Just a few questions.
Okay, so convalescent antibodies are those that are produced after someone has been exposed. You find people who have recently had the infection, they've cleared the virus, draw some of their blood, and you can take fractions of the blood through chemical processes and purify that person's antibodies. That's been going on for many, many decades, and it's a common approach. It has a lot of benefits, has some side effects potentially there because it's a protein from somebody else. So you can have a developing reaction where you would be sensitized to somebody else's proteins. Antibodies are protein. What we have to acknowledge here is there are better ways of doing that in the modern era. We can make monoclonal antibodies, which are highly specific and very purified, and we can control the other portions of the antibodies where you have a reactive section of protein, and that reactive component can be allergenic. So the antibody has two ends that react to the virus protein, one end that acts with your white cells, your blood circulating system, and it takes the antigen, the virus, out of your system. There are currently about 4 companies. This morning on the news, they were discussing monoclonal antibody therapy. It's just like the convalescent serum, and it's safer because it's more pure. And it's also more readily available because you're not relying on somebody who is just sick. So it's an effective treatment. It's showing a lot of promise for people after they're infected, and it's being prescribed quite a bit. I saw that Florida is ordering the largest number. Not only do they have an older population in general who are more susceptible, but the monoclonal antibodies are very effective. President Trump got the monoclonal antibodies from Regeneron when he was ill.
Are there any side effects that you're aware of to the monoclonal antibody treatment? Regeneron, which the ones I think most of us are most familiar with, has been around a long time. Have you heard any? And, I play poker, so I understand things of 1 in a million aren't you can't really say that cause A, B, C, or D. But at the end of the day, it's much safer, is what you said, than the convalescent antibody. Are there any known issues that we have with the monoclonal antibodies?
The only ones I'm aware of would be an immune response where you develop a response to the protein that the monoclonal antibody is. There again, it's expected that you would be treated with a monoclonal antibody only one time for one episode. So when you have a response to something like that, a response to a protein, that would usually happen after a prior exposure. So the first exposure sensitizes you, and you would react then to a second. So first of all, it's rare. and it'd be unlikely that you would get 2 doses far enough apart to have that reaction. I've not heard of specific reactions, and I must say there's not a lot of literature out there on this.
Makes sense. All right, so now let's talk about a vaccinated population that now have got low levels contamination, that they are contaminated. You and I are old school microbiologists. We talk about shedders, people shedding. Are there such a thing as, can there be such a thing as COVID-19 shedders that are asymptomatic?
A COVID-19 shedder would be somebody infected with the virus.
Yes.
And that person would be spreading the virus like any other infected person, sneezing, coughing, speaking, that sort of thing. The vaccine does not have COVID-19 virus in it. The Johnson & Johnson vaccine uses an adenovirus as the platform to deliver the antigen. That adenovirus is modified to produce a COVID protein, and it's not an infectious virus. It starts, it replicates a few times, it's done. The mRNA vaccines only produce a spike protein, and they do it for a short time. mRNA is a very unstable molecule. In order to get that mRNA in, it has to be coated in a lipid. That lipid is injected. It is the mRNA in lipid is taken in by your white cells. It's recognized as something foreign, taken in, and then the white cells digest the lipid, exposing the mRNA, and for a number of hours, perhaps, your white cells are producing the protein. That's the spike protein, only the spike protein, and you won't have any virus being produced. So it's a very high-tech, smart way of delivering a protein only, not the virus. And then your system makes antibodies to that protein. It's as safe as you can get. There are a number of allergic responses that have been reported, and then your system will have it's actually a rather controllable reaction if you have that reaction. Low frequency, just like any other immune allergy response.
We hear questions. We hear questions about, I'm worried that if you get the vaccine, my child can get cancer 5 years from now. Where did this come from?
I have no idea where thinking like that comes from. I was skeptical when I first heard the idea of using an mRNA method of producing the antigen. There's great safety in this, again, because the mRNA does not last long. It can't incorporate into much of anything in the human genome. So the idea of getting cancer from it is very far-fetched, and it actually represents an unscientific thought process.
Well, then I'll tell you what, we're going to close on something. I'm going to give you the best unscientific thing we've heard. I had to go out and buy magnets to bring home to a family and show them that their arms were not magnetized from the vaccine. There is a belief, thank you TikTok, Twitter, Facebook, Snap, whatever they are, that once it gets out there, that there are either chips from Bill Gates or magnetized particles in your arm. Do you think the FDA evaluated that?
I don't know that they specifically evaluated that, but if that were actually a real event, there is a reporting system. Uh, it's the Vaccine Adverse Event Reporting System called VAERS. And anybody who has such a reaction can report it to FDA and CDC, and it would be evaluated uh, by medical professionals. I have not seen any evidence related to anything like that. And I find it almost comical, except that it's sad that information like that is being spread.
And that is the sad part. The sad part is that there are people that believe that. There are people that actually believe that and that are trying to make decisions on whether or not to get a vaccine. That's very difficult to argue, stripped from reason as a tool. So, David, thank you very much, my friend. Do you have anything that you'd like to add on our issues of corona today? Vaccines, treatments, or the other?
I would just encourage everybody who has any doubts to speak with their physician. And definitely, I encourage people to get vaccinated if they can.
Well, thank you, David. And I must tell you, as soon as I can get a booster shot, I'm getting it. And I'm telling all my children to get it. Now, my children, they're older than 18, so they're all getting it. And so they will get a booster shot. And please use common sense. But I also beg you, do not be paranoid. Use common sense. Use knowledge. Use all the facts and the grace that God gave you to figure out what is truth and what is fiction. So thank you very much. Have a safe day.
Click the subscribe button and hit the bell icon so you can be notified when we post new updates. You can also follow us on social media under Eagle Analytical.